Hello, everybody. Welcome to another episode of the Abundant Wellness Podcast. We have the immense privilege of having Miss Christina Trautman here with us today. She is a pelvic floor physiotherapist. Did I say that right? With a
Yep.
doctorate in physical or physiotherapy and a pelvic rehab practitioner certification, plus a
Yeah.
bunch of other things. But I'm so excited to have you here. I know that we connected actually through me coming to visit you for my own pelvic floor stuff. And I've just found you to be an incredible resource in our community, our local community, but also the online community. And so I wanted to bring you on for my listeners today and just talk about all the things pelvic floor related.
Cool.
So why don't you share a little bit about what kind of prompted you to become a pelvic floor physical therapist, physiotherapist?
Yeah. So I've been a pelvic health and kind of just ortho PT for about 14 years. I originally wanted to be a physical therapist in seventh grade when my granny had to have home health PT. So
Mm,
at the time, I knew like this is what I want to do. This is really cool. Me and this PT during my lunch breaks during middle school, I would come home and like help her with exercises. And she eventually went on to do tennis in the Senior Olympics. So it was just like a really fun story. And I just kind of knew I always wanted to like help people. But starting at about 7 years old, I started having stress incontinence. And it wasn't really until college that I started to get some of my pelvic floor issues addressed. So I had stress incontinence. I developed a lot of pelvic pain, horrible periods. I really wish I
mm.
had some of your information back then because it probably would have helped a lot.
Me too.
Um,
Me too. Yeah.
Horrific like pain with like putting in tampons. I had back pain, I had pelvic pain, my nervous system was all out of whack. And so I was just this tight little ball of energy basically. And so I had a lot of issues. So I started seeing a pelvic floor PT because I started working there as a job during college, and it just was maybe a God thing, but she was a women's health specialist. And so she, kind of started to see some symptoms that I was maybe having just based of me walking around the clinic and different things. And eventually was like, do you have pelvic floor issues? And I was like, I don't know. I think so. That sounds right. And so she started
Yeah.
treating me. And over the course of a couple years, definitely on and off, just being a college kid and not really kind of knowing exactly how to kind of handle all of it.
Right.
I completely like almost, I guess I would call it getting cured, I guess, from all my symptoms. I still had some other symptoms later on with like having my first and second babies and stuff, but that's really from that experience. I was like, I need to do this. And I already knew I wanted to be a PT. And so that just was like, oh, this is just this cool like specialty that I have firsthand experience with. Um,
Yeah.
I want to help these women. And so I really actually like my first day of work was seeing an incontinence patient. And so
Mm,
while I was studying for my boards, I was also taking women's health classes in PT school, because I was going to be starting doing this women's health stuff too. So yeah,
wow.
it's been a while since I really wanted to do this, and I love it. Yeah, it's
I
really fun.
love that. I love that. And it's such a huge need. I mean, it's a huge need for so many different reasons, but I think the primary, you can add your own 2 cents to this as well, but I would say the primary reason is that so much of our pelvic floor health goes overlooked, right? Like I'm thinking of
Yeah,
my own GYN journey, right? Where didn't really have any pelvic floor issues. Well, I probably did, but like obvious pelvic floor issues until after I had my first daughter. And
yeah,
actually I started having some incontinence, bladder incontinence with her towards the end of my pregnancy. And never really addressed it because I just thought like this just happens, like it's
yeah,
just part of pregnancy. All the women in my family pee their pants when they sneeze, like it's just part of the thing. And I didn't like it, but I figured it would just go away right after I have the baby. And in fact, it got worse. And so, but again, I didn't really know that there were other avenues to address it because I went to my OB, had my 6-week checkup, and everything's fine, right? And
yeah,
so But there were, elements of that missing in the sense, or pieces of information that were missing in the sense that they didn't tell me that I had like a third-degree tear. They didn't tell
Yeah.
me like, there was a lot of stuff that impacts the
Yeah.
fascia and the tissues and everything else.
Yeah.
Um, and so, so then you go on to have subsequent pregnancies. And I know I'm not an unusual, I'm guessing,
No.
client. Like,
No.
this is everybody that I talk to, right? And so,
Yeah.
but one of the things I wanted to talk about was one, how to recognize when you're having pelvic floor issues. And then let's chat a little bit about how things like our diet, being constipated, having functional bowel issues, um, impacts our pelvic floor, or even like chronic stress. I think that's a big one that people don't
Yeah.
realize, that our nervous system plays a huge role in that as well. So,
Yeah.
um, so what are maybe some like basic warning signs that you're not going to get your answers from like an OBGYN, that we think that's probably that was where my brain thought I should go, right?
Yeah.
But that we actually have functional issues that can be addressed through PT.
Yeah, there's definitely a huge, I guess I would call it a women's health gap, right? Where we have an OBGYN or a gynecologist, and they have these different boxes that they can check off if you have these issues, right? You have cancer,
Yeah,
you have a severe prolapse, you have all these other issues. But I mean, 80 to 90% of women don't fit in that side of the camp, but they're also not well either. So we
right,
have this huge group in the middle that we're just completely missing, right? And our parents' generation, I'm seeing those people in the office, 60s and 70s, and they've been having prolapse for 40 years because it was never addressed earlier, leaking for that long. And
right.
so now I do think we're doing a better job of it, but yes, like I am the person for, I don't feel right. I don't feel necessarily like horrible on my deathbed, but I don't feel good. And I know that I
Mhm.
could feel better. And so yeah, some different symptoms that are common, but not normal, I'll kind of put it that way, are, I would say leaking and incontinence is probably the number one thing people come in for. And a lot of moms are like, yeah, but I only leak when I jump, or I only leak when
I sneeze
I
or I
sneeze,
cough.
and I only sneeze from March to June during, allergy season.
Hmm.
And it's kind of like me saying, oh yeah, my car only leaks engine fluid when I go really fast around a curve, but otherwise it's totally fine. So I'm just going to smack a little pad under that engine oil because it's probably fine,
That's
and
a
like
great
every car,
analogy.
10 years old, it's a 10 years old car. So it's eventually,
Right,
that's normal. And it's like, well, is it? Or would we really truly, like, if your car's leaking engine oil, you would immediately take it to the mechanic. Like you
right,
wouldn't like mess around.
totally.
I kind of call it those like check engine lights are coming on, right? So
Hmm.
leaking incontinence is definitely number one. You should never have pain with sex. In terms of like you have two committed, both of you want sex, essentially, there should never be pain with insertion or penetration. If there is, there generally means there's something wrong with the tissues in terms of being too tight or too weak,
Yeah,
or organs aren't in the right place. Um, and then prolapse, which is kind of like a heaviness, pressure sensation vaginally. You will feel that sometimes during pregnancy, obviously because of the baby, but it feels more like a superficial vaginal really feeling versus more in the abdomen. Um,
right.
and a lot of people with really mild prolapse, they'll only have it during their period. And some people are like, well, I thought that was normal to have all the time, which
Mm-hmm.
isn't. But it starts, if a really mild prolapse, it will start with just having that pressure heaviness during your period, and then eventually just starts to kind of increase. Low back pain, hip pain, all of those kind of things kind of fall into the pelvic floor arena. So I would say those are probably the main pieces. Constipation is probably something most people wouldn't necessarily like, oh, I need to go see a pelvic PT for this, because constipation is affected by so many systems, as you
Right.
know, right? There's so many factors that play into it. But I would say most of my patients, probably a good 70%, when I ask them, are you constipated? They're not always like, oh yes, 100%. Like I have a harder bowel movement, or I only go every hour, like a day and a half. Like, I don't know. Like, it's like such a normal thing to them to have
Right.
constipation. that it's not like this big, huge issue, but I would say a lot of people do struggle with it, which plays a ton of stress on the pelvic floor. So I am very passionate about good poops. And I'm
Yes.
a little obsessed with them maybe, but it's really important to me for people to poop well, and no one is asking them. Like their doctors aren't saying like, hey, are you sleeping 8 hours? Are you getting out in the sun? Do you have a good bowel movement every day? Like they're not asking that question. And so,
No. And then you have all of these people falling through the cracks, right? And then they're
yeah,
coming to you or to me, right?
yeah,
And so it's like we're kind of trying to create this net
yeah,
of how can we catch these people that are not actually getting the help that they need.
yeah,
But it's very true because if you think about just taking constipation, for example, there can be many, many different reasons for that. And we actually had a conversation about this like a month ago or so, where we were just brainstorming what could possibly be going on with this person that would be causing these symptoms that they're having. But it create, constipation can be from nervous system dysfunction, from being in fight or flight for too long. And if your doctor isn't asking you, or more likely they're asking you and they're telling you that it's normal to only have a BM 3 times a week, which it is not,
ugh,
um, that's going to create a lot of long-term problems.
yeah,
And they will get worse typically as we get older. And like you said, you may notice them only during that time of the month where there's increased blood flow, there's increased pain, there's increased nerve reception that's happening. So you're more
yeah,
aware of this discomfort that's happening. Um, and then eventually, it will start to spill over into, no pun intended, but like it will start to not just be impacting you during that time of the
yeah,
month.
absolutely.
Sure.
Yeah,
And one of the things I remember from our appointment was, I feel like I'm a pretty educated person, but I was like, I don't know why it never clicked for me that like how well I'm breathing actually impacts how I'm able to engage my pelvic floor. Like
yeah, it's
I've
huge.
spent 13 years trying to do Kegels, and you're like, things are too tight. Your muscles are
Yeah,
too tight. Your back is out of alignment. Your hips are out of alignment. You've got to go to your chiropractor, get some things worked out, and then we can do these other things. But it wasn't that I wasn't doing Kegels wrong. It was that I wasn't doing the right exercises for what the problem was. And
yeah,
honestly, unless you're working with somebody that can help you to identify that, um, you're going to spend, like me, 13 years trying to do Kegels and wondering why you still sneeze when
yeah,
why you pee when you sneeze, right?
yeah.
So, um, so there was another question I was going to ask within that. Um, I can't think of what it was, but okay, so let's say if somebody comes to you and, they're coming to you for, let's say, bladder leakage. What are
Okay.
some of the other things that you're assessing for within that? Because I know for me, I was like, oh, this will be simple. She'll tell me that I'm not doing enough of my PT exercises and we'll just go on our way and it'll be, you know,
Yeah,
whatever. I don't know what I thought it was. But really there were multiple, like my ribs were really tight because I was under a lot of stress. And so I had to work on my nervous system as well as all these other things that were going on in my body. So
correct.
that's
Yeah.
my loaded question for you.
So yeah, so it kind of depends on what type of leaking first. So we have stress incontinence, which is probably the most common type, where you are leaking because there's an intra-abdominal force that's greater. So that pressure coming down from the top is greater than what your pelvic floor or that urethral sphincter basically can keep closed. So leaking really truly for that issue is like a physics problem, right? Like what where are these pressure changes and how can we balance them out? So
Hmm.
that's the leaking with coughing, sneezing, jumping, sex. So there's a specific movement that causes it, right? And it kind of depends, like if someone's a little bit younger. So for me, like, why was I leaking at 7 years old? I was so tight that anytime I had this downward force, so all my leaking was with laughing. And my best
Okay.
friend had this amazing laugh that would just make anybody laugh, right?
Yeah.
She laughed
Yeah.
all the time. And so I was leaking all the time. But what was happening is I had this intra-abdominal force that was so great, but because my pelvic floor was so tight, a tight muscle is not a strong muscle, right? When we think about like physics and the length to tension ratio, if a muscle's really shortened and stuck in that shortened stage, it doesn't know how to fully lengthen, so it doesn't know how to fully contract, right? It's just stayed in this like tension. And that's what my pelvic floor was doing. It had literally no strength. And so you kind of imagine like a balloon, a water balloon, and we have this downward pressure pushing that water balloon down. Well, a normal, like healthy pelvic floor would be like a trampoline. So when that pressure is being pushed down, that trampoline's absorbing it, right? And that water balloon staying packed and coming back up. Versus what I had, which was a like brick wall. And so when that intra-abdominal force was pushing down, where is it going to go with a brick wall, but out, right? And so a lot of people think, oh, leaking, and they just assume I'm so loose, I'm so weak, I need to do more Kegels. And that could be true, but I would honestly say more often than not, it's because you're too tight and you don't know how to fully relax. So that's more stress incontinence, which has to do with more pressure issues. And then we have urge incontinence, which is more you have an urgency, feel like you have to go pee, you're on your way to the restroom, and there's water running you here, there's some type of trigger that will immediately, you'll start leaking. Well, obviously there's no pressure changes that's causing that leaking. That's actually more of a nervous system issue. So we have the detrusor that surrounds the bladder. It's a big muscle that surrounds the bladder. And when that contracts, that's what we sense as urge. And so basically there is a miscommunication between the brain and that detrusor muscle. And so a lot of that more is like retraining, and we have to retrain that detrusor muscle using some pelvic floor strengthening exercises. But that one's a little bit more generally, people are going to be a little bit weaker with more urgency issues. That's, I don't tend to see as much tightness and higher tone with them. So that's, yeah, I would say that's a bit more kind of weaker things that we're looking for there with that type of leaking, but that's a bit more like behavioral too. Meaning how much acidity are you eating and drinking, right? In terms of a nutritional standpoint, is your pH levels really, really high or really low? You know, the pH likes to be, of the bladder likes to be pretty neutral. And so looking at that, looking at what are your bladder habits? And so I'll say these things and a lot of people are like, does anyone do that? But so on average, if we think about a woman who's 160 pounds, let's say, okay, so she should be drinking about 80 ounces of fluids per day, 75% of that being water. That's our goal, right? About half our weight in ounces you want to be fluids, most of that being water. And so with that, we should be going about every 3 hours. You get an urge signal around 2 hours. That kind of goes away. And then around 3 hours, we go to empty our bladder. Takes about 10 to 15 seconds to empty. And we should not be going what I call just in case. So everyone on here probably has done just in case peeing, of where we pee before we leave the house, before we go anywhere, right? Because we may have to go, you know, before we get there, but there's generally bathrooms at all the places that we are usually going. And so trying to avoid going to the bathroom unless your bladder is telling you that you should, because that can create, like, the more often you go where you don't get the urge, it starts to create a more sensitive bladder. And that detrusor muscle will start to contract more, sending those signals to your brain saying, hey, you really got to go, when maybe you're only like a third full. And so a lot more of the urgency and urge incontinence has to do more with like diet and your kind of bladder habits, and trying to avoid like pushing to pee, or going too frequently. Those kinds of things kind of play into that a little bit more. So those are kind of the two main differences. And then there's what's called mixed incontinence, where you can get both. And generally someone who has mixed incontinence is going to be not 15, you know, they're going to generally be probably after having kids, after having babies, are weak and maybe tight. They're wanting to get back into exercise or too soon, like more than their pelvic floor is ready for, and they can actually have both. In my opinion, I think urge incontinence is like harder to deal with, just because there is more like pain and there's not as much like warning, at least with stress incontinence, like, oh, I know it'll happen when I cough or sneeze. There's kind of like a theme
Right,
to it versus urgent continence kind of just like
right.
happens kind of willy-nilly sometimes. So,
Yeah,
so those are the kind of the main
that's
differences.
really helpful. Yeah, that's really helpful to explain because I think, like even I would read that on like a post or something, like a blog or something and not necessarily know the difference. I know what
Yeah,
urge is. I know what, like I think most people understand what that means to have an urge
yeah,
to pee or to be like a stress peer, right? Or
yeah,
whatever. But at the same time, it's yeah, just the way that you broke that down was super helpful. And it kind of leads me to the next question, which is the loaded question that most people don't think I think they would not expect their pelvic floor therapist to address, and that is diet and how diet
yeah,
impacts the pelvic floor. So you already mentioned like higher acidity, which obviously irritates the lining of the bladder and is in general not super great for the body in
yeah,
general.
yeah.
Um, but what are some other things that we might want to know about our diet and how that protects or preserves or strengthens the pelvic floor?
Yeah, so I ask every single patient, like, what are your normal like dietary habits? Are you eating like 50% whole foods, 80% whole foods, 100%, just to kind of get an idea? Yeah, how often are you having a bowel movement? That's information is really important to me. How much are you drinking? How many fluids are you drinking? How often are you going to the bathroom? So all of those habits, right? And so, in my opinion, in terms of like nutrition on the pelvic floor, the more regular and like consistent your bowel movements are in terms of being like soft and formed, no straining, if that's happening daily and that's pretty consistent, you're peeing every 3 hours, you're not having many issues, you're not leaking, like that's telling me that you have a pretty good concept of nutrition. And so when we start to have issues with constipation, we start to have more leaking, we start to have more urgency. I can definitely tell that like the dietary piece is at least a factor. It's at least part of it. And so we'll talk a little bit more about so like, yeah, I would say with leaking and bladder stuff in terms of like nutrition, I feel like hydration's probably the number one thing. 80% of my patients are dehydrated, like
Yep.
100%. When I tell
Yeah.
a pregnant
Same.
patient I want you to drink 100 ounces of water per day, like they look at me like I'm an alien.
Yep.
Or when I just tell like a 60-year-old retiree, like, hey, you should be drinking 80 ounces a day, and they're like, oh, maybe get 20 in. I drink like other things too, but like maybe 20
Not the
ounces
same.
at
Yeah.
most. And so I would say we tend to be pretty dehydrated. And so a lot of people are like, well, I leak already, and so I don't want to drink more water because then I'm going to leak more. Well, that actually doesn't work very well, because when we drink less water, we're creating more acidic environment for our bladder, which is
Right.
creating a more irritated bladder, and it's going to want to get rid of that. And so, if you try to reduce your fluid intake, it actually can create more of a leaking issue. So hydration's huge, but also really important for bowel movements too. We need water to be absorbed within our feces in order for that to get out of our body, right? And so it's really
Absolutely.
important we keep that hydration up. And I'm a really big proponent of magnesium, so I recommend that a lot to patients, specifically if they're pregnant. But if they're not having like a soft and formed bowel movement, their diet's really keyed in, we're looking at their pelvic floor, sometimes adding a magnesium supplement can just help make those bowel movements a little bit more soft and formed, to where they're not having to strain. So if we can really avoid straining, that's could really like help decrease a lot of strain and stress on those organs and on the pelvic floor itself. And so from a more constipation perspective, water is huge. Now, and I know you've talked about this before, but like fiber, like how much fiber should we be eating? Like what kind of fiber should we be eating? And so
Mhm.
that, I honestly feel like that does kind of depend person to person, but yeah, it depends on your diet. It depends on how much nutritionally and like natural fiber you're getting in versus how
Right.
much should we be like supplementing. So I think like the average we are supposed to get not from a US perspective, but like more worldwide, is about like 30 grams of fiber per day. I
Mm-hmm.
think the average American gets in maybe 6 to 8.
Yep.
And so if we think about that, obviously we're going to have to supplement a lot. So a
Mhm.
lot of people who eat a true like American diet probably are using some type of laxative, right? They're using Miralax, they're using
Right.
Metamixyl, they're using something like that because they need extra support. When if we ate a little more fiber, we drank a little bit more water, we had a good balanced pelvic floor, we probably wouldn't have to do a lot of those extra things. I like magnesium because it does help with your bowel movements and it's not a laxative. It's, I guess it's under the category of an osmotic laxative, but it's basically just pushing water into your feces. And so
Right.
it's not bypassing any of the defecation process like Miralax is.
Right. Right.
And so I find it to be a little bit more natural and like safe.
Yeah. It's
But
great for the nervous system too. And
yeah,
so if there is the nervous system component of constipation, which is, maybe fight, flight, or freeze, probably like a freeze nervous system state,
yeah,
and we want to create, a relaxation of the nervous system so that we're not clamped down, right, or not moving, magnesium can be really great for that. Same with walking,
yeah, yeah,
But then sometimes those pelvic floor issues can be a barrier to doing the exercises, right? Or doing the movements or you've addressed so many of them already, where it's like, well, I don't want to go for a walk or I don't want to go for a run. When we need that physical dynamic
yeah,
movement,
yeah,
to keep a healthy pelvic floor. So I think this is where, personally, it is extremely helpful to be working directly with somebody
yeah.
like yourself to help
And
identify what are some of the
I
roadblocks.
I think people think like you don't have to work hard to have a good bowel movement, but like in our country, like you have to work hard. Like I
Hmm.
have to work really hard at getting enough fiber in per day. Like if I were to have like the natural like American diet, like I would be so constipated all the time. Like
Yep.
I have to work hard at drinking all the fluids and getting enough fiber in and getting that 30 minutes of exercise in and having a calm state of mind and getting, you know what I
Yeah,
mean? So I think a lot of people are like, well, this isn't working
it'd
for
be
me. So I guess
easy.
I just need to add some Miralax or
Hmm.
whatever. And it's like, well, are we looking at the other side of the coin too there? And I do feel
Yep.
like that's a huge piece that we're just medicating, like we do with
Hmm.
everything else instead of looking at
Right.
the functional pieces to our life.
Right, which is having to change how you do things. Like I even
Yeah,
remember, when I worked on the floor at the hospital, we had 13-hour shifts, sometimes longer, and you couldn't always choose when you had to
yeah,
go to the bathroom, right? Like it's if my patient's coding, I can't just go have a number two. Like that doesn't work. And so that does create unhealthy habits, and it goes
absolutely.
right
Yeah,
into the we have to be willing to address our lifestyle and the things that we are doing that are contributing to the problem. And that means
yeah.
slowing down.
And I,
It
I
means
actually
eating your
see a
food,
fair
right?
amount of that occupational leaking of like,
Mhm.
I have a bus driver who she can't get off the bus and she has a 4 hour bus drive that she has to do. And she literally can't do anything within those 4 hours. Or I have a counselor who she can only pee in between appointments. And so she just goes pee every single hour, which creates this sensitive. Or I have an ER nurse who's like, yeah, I'll be lucky if I can go every 5 hours.
Mhm.
Or a teacher. She's like, I go in my like maybe at the beginning of the day, I go at my lunch and I go at the very end. Like I can't leave
Yeah,
my kids at all.
right.
And so trying to help these people like figure that out, I actually is a big part of it because I'm like, I want you to have the most like functional, balanced system we can. And we just got to work around some of these other issues. So yes, you may not be the person that's going every 3 hours during that work day or during that specific time, but how can we get it a little better the rest of the time? Or how can we
Right.
improve even within that specific day? Or for you, like I would help someone to have a bowel movement before they went to work. And how can we figure
Right.
out time wise and how to do that? And when do we take the magnesium or when do we drink the water? That kind
Yeah.
of stuff too. So that actually is a big piece to it.
It's a
It's tough.
huge piece.
Yeah.
And also I think what it confronts is, we have to be willing to, for myself, advocate for ourselves in our work environments, right?
Yeah. Yeah.
And, I think what kind of broke me of some of that was I was nursing and I had a baby at home. And so we have to take pumping breaks, and we are, required by law or we are allowed by law to take pumping breaks really as often as we need to, within reason, obviously. And so as I learned to advocate for that, then it became easier for me to say, like, nope, I am taking a 30-minute lunch break where I will not be answering my work phone, which
Yeah.
means that somebody else has to take over my work phone so that I can, have this break where I'm eating not in a state of constant stress. I'm allowed to
Yeah.
fully rehydrate myself. And it's hard because, especially in the medical system, those that work in the medical system, it is not wired
Yeah.
for our healthcare providers to feel safe and happy. It is built on efficiency and, how can we get people basically in and out in as quick of a turnaround as we possibly can. So
Yeah.
it does create different challenges. Being a mom of young children creates, different challenges, because how many of you enjoy going to the bathroom when your toddler's screaming and banging on the door,
Yeah.
Like I think every season of life is going to present what we feel like is an impossible
Yeah.
obstacle, right, to
Absolutely.
overcome.
Yeah.
And but one of the things I loved, and I still practice this like as often as I can, that you taught me, which was, and I'm going to do a terrible job of explaining it. So please go see Christina to get the full explanation. But it was, you did something that was like a maneuver where I was learning to breathe, and how I felt a shift in my ribs that actually told me I was engaging my pelvic floor. So I wasn't waiting for this feeling in my pelvic floor that I was engaging it, because I couldn't always tell when I was engaging it. That's kind of how
Yeah.
disconnected it was. And I use that when I'm doing the dishes. I use that when I feel like I need to pee, but I don't really need to pee. I use that when I am going for walks. I'm just going to use this time to engage and like get
Yeah.
my brain and my body connected.
Yeah.
And it's helped a lot, like even
Cool.
just those little things. So it doesn't mean that you're going to have this big, intensive program, right? Even some
Yeah.
people probably do, but it doesn't mean that you're going to have to do that to fix the problems that you're facing. But I
Totally.
think getting the right support, and the other aspect that I kind of want to touch on with this is you do see like women with hormonal imbalances,
Yeah.
endometriosis, pelvic pain, severe bloating before their period. And so addressing the hormonal aspect that's contributing to those dysfunctions is really important too, because
Yeah.
as we get older, even things like a drop in estrogen the week before your cycle or 3 days before your cycle can lead to
Yeah.
urinary frequency, right? Or increasing urge to pee. So if you're only noticing those symptoms 3 days before your period or when you're in perimenopause or menopause, then that's a good indicator that you also need to look at your hormones and see, some of it's not maybe structural, but it may be the hormonal communication piece that is
Yeah.
contributing.
Yeah, absolutely. And I think a lot of those patients that do have those, I think are also seeing you because I
Yeah.
send most of them to
You
you as
just,
well.
yeah, send them back
Um,
and forth.
but yeah, I think tackling both of the sides to that of, okay, let's look at the hormones, let's help get this stabilized. And then structurally, physically, functionally, let's also help you figure out these strategies during the day to make sure everything is as balanced as possible. And I would say I don't give like the most mind-blowing exercises, right? A lot of stuff I give is really pretty basic, but I'm just helping you become a little bit more aware to
Yes.
a lot of these different areas. And I guess basic's the wrong word. I would say it's definitely more like people don't feel like when they leave, like their mind's exhausted. It's not their body so much. Like their
Right.
body, like they'll feel fatigued
Yeah.
somewhat, but like helping them connect to the muscles and helping them know, okay, this means recruitment, this means activation, this means relaxation, and helping them kind of figure out how to initiate those muscles and
Yes.
stuff. That's where a
Totally.
lot of the pieces that I come in, just helping you to connect, yeah, to your body, your abdomen, your pelvic floor, your hips, your back, and just helping you to kind of, yeah, just kind of be more aware of what's going on instead of where most of these moms live, which is just sort of in survival mode. And then by 8 p.m.,
100%.
you're in a horrific pain and you just want to slump over and watch Netflix. And, and so
Yep.
trying to find that balance during the day so that you don't feel so crappy by the time you put your kids to bed.
Exactly. And even, I think that's really helpful to talk about because, as moms, we can be in survival mode for what feels like a really long time. Or maybe, we feel like we get out of the trenches of changing diapers and toddlerhood, but maybe our kid is going through a crisis or a health issue or whatever. And all of a sudden you're right back to that place where you feel like you don't have the time to take care of yourself. What I
Yeah.
love about how you teach is that it is so simple and it is so basic that I don't feel like I'm having to spend extra time. I don't have to carve out a ton of extra time to do this thing. I can be standing
Yeah.
there doing the dishes. I can be folding laundry and engaging my pelvic floor. I can be walking. And
Yeah.
so it's not, yes, there are those specific times that I do set aside, but it's not, you don't make it impossible, which I love. So on that topic, how does somebody, I mean, obviously anybody that's in the Portland, Vancouver area needs to come see Christina. Um, but if they're not local, what are some things that you look for in your referrals? So like if you're referring somebody out, that's not local and they need to find a good pelvic floor
Yeah.
person, what are some things that you would encourage them to look for?
So I got my certification through Herman and Wallace, which is a great group I really like. So if someone were to reach out to me and say, hey, I live in Louisville, Kentucky, this is my zip code, can you look up a good pelvic PT for me? So I could help them with that if they needed to,
Um,
but I generally would say private practice, you're gonna find a little bit more holistic person than by someone who's at a more corporate type of place. So there are some good PTs there, but it's kind of diamond in the rough. So, and which a lot of private practice now are more cash pay, which is kind of where I am, but it's kind of like you get what you pay for, you know what I mean? And even if they are insurance pay, you have insurance and they take your insurance, like they bill out still so high that you're still going to be spending a decent amount of money on it. And
right,
so sometimes it's like, well, if we're only going to go for a couple visits, it might be worth just seeing someone who's a little bit more. So like the solo practices are probably my favorite. So because that they are like they're not making hand over fist money, like they're just
right,
not. They are they care more about quality of life, right? Like they probably have a family, they care about flexibility, and so they're generally going to be a better practitioner than someone who's working in the hospital and is overworked. They may make a decent amount of money, but
right,
they are on a time crunch. They can only do a certain amount of things because insurance is only reimbursing these specific codes.
right. Yeah,
And so I would generally say like private practice, solo. Obviously, the more alphabet behind their name can
yeah.
mean a better practitioner, but it's not always.
Not always,
Someone
yeah.
who has 15 different certifications, like that's all they're doing is school, and they're not really getting their hands on a lot of
And with
people. And
people,
so,
yeah,
yeah. And so that's not always the best, but it can be. And I think just getting a good vibe. My sister was asking me for a chiropractor and in Portland, and I didn't know them, but we looked them up and I was like, oh, she looks nice. And she looks cool. She looks like she would like listen to you. And like
friendly, yeah,
you can tell a lot by someone's picture. So just kind of researching them a little bit, going on their Instagram. That's a big piece now. That didn't used to be the case 10 years
yeah,
ago, but you can learn a lot, I think, about somebody just by kind of researching them a little bit. Look at their reviews. I feel like that's a big piece too.
totally.
But I do feel like you're probably going to end up paying a little bit more upfront for someone and maybe getting a little bit more holistic care and better quality care. I see a lot of really disgruntled patients who go to the Vancouver clinic, who go to these more corporate places where I used to work
Yeah,
at those corporate places. So I understand. And then they paid all this money. They didn't meet their deductibles, so it was all out of pocket, and they didn't really get a whole lot better. They had
right,
these 20-30 minute appointments with this overworked PT, and then they eventually come into my office, which is hour appointments. It's a little bit more kind of relaxed environment and they're getting better
Mhm.
care, but they're again having to pay for, and so, in my
Yeah,
opinion, just pay for it to begin with, and you're probably going to save a lot of time and energy doing that. But definitely
right.
do some like research. And yeah, if you can get a referral, obviously that's the best, or like word of mouth, friend going there or whatnot. I feel like that's probably the most ideal, but reach out to
Absolutely.
me, like feel free to email me, if you'll give them that information, and then they can always ask me and I can help them to find a good one.
Absolutely. Yeah, I absolutely will. And I think it is such a tension. I mean, I feel the customer side and I also feel the practitioner side because
Yeah,
I live in both worlds
yeah,
where insurance does not reimburse any of my services. And they won't. I don't foresee that changing. They don't cover nurse coaching, anything. And so it's a bummer. It is a bummer. It's a bummer as a practitioner to not be able to provide some of that stuff. But at the same time, it's like I'm not going to compromise my level of care or my level of expertise
yeah,
simply because of that. Like I'm not going to short sell the client just because of that. And so how do we find
yeah,
that like happy medium, right? And so I love that you gave some pointers on how to find and kind of vet good people. And I think even I don't know if they do this in corporate world or like even I think solo practices do this more where they are willing to do like a discovery call with you. Let's have a little
yeah,
Q&A. Let's talk together and figure out if
yeah,
I am really a good person for you because I might not be the best personality to help you and that's okay, you know?
yeah.
Um,
Yeah,
I
I
think
do that
that's
15-minute free consult. It's like a video consult just to see, if I can help answer questions and if they're interested in PT but not sure like what a first appointment would look like. I do that. But yeah, you probably, if they take insurance, you're not going to see that just because they don't have
no.
time to do that and that
Well,
doesn't get
they
reimbursed. So
don't. Right. Right. And so, yeah, so you do get what you pay for. And sometimes we just have to budget for the things that are important. And like you said, you might be able to knock it out in 3 sessions where, and they now know like they're connected to their body. They know how to move their body. They've had somebody kind of show them how to do that in a way that ends up saving, not only their time, but their money in the future with, needing surgery or something else like down the road that we're trying to protect and prevent from happening.
yeah.
So you do have one of the things I love that you have available that is a great resource for those of you that are not local. You do have a couple online program options. So you have the incontinence course and then you have a birth prep course. Is that right? Can you tell us a little
Yeah.
bit about those?
Yeah, so my birth prep course, that was just like kind of my baby from going through two births myself and not, I mean, obviously I had the education to kind of know what to do for them, but I took some birth courses really to, it's kind of for like more marketing purposes, but I was really like sad at how little the pelvic floor was mentioned in all of it. And so my birth prep course, we go over a lot of exercises that you can do to kind of help balance your abdomen and pelvis and help keep baby in the best position during your pregnancy. And then I do a lot of like helping you find your most relaxed pelvic floor in different laboring positions, whether you have an epidural or don't have an epidural, how to push properly. And that's all online with different videos. There's like 13 different like sessions on there. That's
Mhm.
$99 for that course. And yeah, I feel like
Wow.
it's pretty well-rounded and you get all these handouts that come with it. But there's just a little bit more emphasis on and then we go to the hospital to have a baby. All they care about is liability, right? We want to keep mom okay and baby okay and get them the heck out of here as soon as possible so we don't have to deal with any like other issues. Like that is the main
Right.
goal, right? They don't care about your pelvic floor. They don't care if you tear. They don't care any of that stuff. They just want to get that baby out. And so I'm wanting to add a little bit more of like, as long as mom's okay, as long as baby is okay, let's put you in the best position to help that pelvic floor so that we can
Yeah.
deal with the less amount of issues as possible. Obviously, if baby's in trouble, mom's in trouble, we're going to do what we need to do to improve that. But if
Right.
it's possible, which 80-90% of the time it is, I want to give you at least more things to think about and more options I had this third time mom this week who was a bar 3 instructor, and I went through all the laboring positions with her in the office. We went over how to push properly. And she's like, my mind is blown right now. She's like, I didn't know any of this was possible, because she goes to Kaiser and she just assumed she was on her back and getting an epidural and that was it. And I'm like, you can get on your hands and knees with an epidural. You can get on your side. There's so many other things that we can do, but you kind of got to push for it a little bit, unfortunately. And depending on your energy level in the moment and your partner, or if you have a doula or not, it's sometimes hard. But there is just a lot more options. And so that course is just a little bit, gives you more information that you're not getting from your OB, that you're not getting from your midwife even. And so it just has a lot more education on
Awesome.
how to have a better birth. And I
Amazing.
had a 5-hour labor and a 3-hour labor, and they both were fantastic. And so I feel
Wow.
like that's a pretty good example
Yeah.
for it. So there's that course. And then I also have an incontinence course online. That my girlfriend who was out of state, her friend wanted to take an incontinence course, and she knew that obviously I did public PT, and she's like, Christina, like, I need a course online. And I was like, okay, I'll make one. And so that
Sure.
was kind
Yeah.
of random, but it was like, I have all these women in this generation, even if they are local, they don't necessarily really want to come in and get their pelvic floor checked, right? It can kind of feel sort of this private thing that they don't really want a lot of people knowing about or talking to about. So it's kind of a cool
Right.
thing to be able to take something like this, get a lot of education and information and apply it. And, it's not meant to obviously take place of a pelvic floor appointment. I would rather you do that like one-on-one, but this is kind of
Right.
nice if either that's not an option, you don't have that local, or you don't have the money for that, but you do have $100 to do this class. It's worthwhile. And that's a 2.5-hour course. It goes through all of the things that we've talked about in terms of stress incontinence, urge incontinence. It goes to fecal incontinence a little bit,
Wow.
all the different dietary and exercises to do to help with those things. Yeah, different treatment options. But I really kind of go into the nitty gritty of leaking a little bit more and what are like the most common things. I actually wanted to do online courses a long time ago, but I've really shied away from them because I really have like an individual treatment approach. And I kind of hate online courses, to be honest, because we're using these cues that may not work for every person, and they may
Right.
actually make someone do something different than what we're trying to get them to do. And so
Yeah.
I truly believe like one-on-one care is the most important thing. So if you can do that, that's what I 100% recommend, whether it's me or any other public PT. But the online courses are great. Like, I think that's probably one of the best things that came out of COVID was that
Right.
we now can
You're
do a lot
forced to
more
do
stuff
something different.
online.
Yeah.
Yeah,
Totally.
so it is an option. But yeah, so both of those I have online.
That's fantastic. And I think you're totally right in the queuing piece because there, I'm just thinking back to my appointment where I'm like, oh yeah, I would have, one, I wouldn't have known how to cue that. And two, I would have interpreted it wrong because
Yeah,
I don't know what it should feel like.
yeah,
So, but for those maybe that are in more rural areas or they're in a place that does not have a holistic, pelvic floor therapist, it can be a great option to get
yeah,
started. And then when you recognize, I mean, it's just like doing an online, fitness program, like even Fit to Be with Beth Learn. I love her stuff. But she's always talking in the sense of like, if you feel this in your body, it might be time to go to the chiropractor,
yeah,
like I can't fix that for you. But I can show you how to pay attention to your body so that you are recognizing, okay, I've gone this far, but now I need to do something different.
yeah.
Um, so I just love what you do. I tell everybody to go see you. So hopefully you're getting some good
Thank you.
referrals from that. But if you want more information from Christina, you can follow her on Instagram at the Pelvic Floor Place. Did I get that right?
Yeah, I think my tag is just public floor place, but
Pelvic Floor
or
Place. Okay.
yeah, know that.
I'll put it correctly in the show notes, but she has a ton of great information on there. She shares some wonderful accounts in there as well. She's got some great information in her link in bio. And like she said, if you have questions about how to find a good provider, you can always shoot her an email and I will put that in the show notes as well.
Yeah.
Thank you so much for being here with us today, Christina.
Yeah, you're welcome.